Good afternoon and welcome to the Committee on Health and Human Services. Secretary, will you please take roll?
Assembly members Dahlia, Edgeworth, Gonzalez, Goulding, Gray, Hafen, Hibbets, Hunt, Jackson, Koenig, Nadeem, Wynn, Orntlicker, Chair Brown-May.
Thank you. I am here. Please mark Assemblymember Gray present as he has just walked in. Assemblymember Hafen present when he arrives, or absent if I missed that message. Let's check that, please. Housekeeping notices. Thank you all for being here. Welcome to those of you who are present here in Carson City. Anyone present in Las Vegas, thank you. I see we have a couple of people in the audience there. And then anyone joining us online. Please silence your electronic devices. You do not want to be the person that has your favorite ringer go off while we're in the middle of a bill testimony. If you wish to testify, please sign in at the table by the door and then provide a business card so that our secretaries can identify who you are. Electronic copies of anything that you're going to hand out should have been submitted yesterday. Members of the public may provide public testimony on a bill either in person or on telephone. To do so, you would dial 888-475-4499, and then when prompted, provide the meeting ID, which is 854-6795-0623, and then press the pound sign. All of our meeting agenda and committee information is available on Nellis, can be accessed through the legislative website. Today we will do public comment at the end of our meeting, and each person will be limited to 2 minutes. Please remember we expect courtesy and respect in all of our interactions, and note that our members will be utilizing their laptops and other electronic devices. Today we have 3 bill hearings on the agenda. We will start with Assembly Bill 304. So I will officially open the hearing on Assembly Bill 304 and invite our presenters forward. And you may begin when you are ready. Please state and spell your name for the record.
Wow, good afternoon. It's great to see all of you from this side. Good afternoon, Chair Brown-May, Vice Chair Wynn, and members of Health and Human Services Committee. I'm Assembly Member Venice Karras, and I have the honor of representing Assembly District 10 in Las Vegas. Thank you for allowing me to present Bill 1304. Give me a moment here. I swear it's a daylight saving thing. Where was I? Thank you for allowing me to present Assembly Bill 304, which relates to electromagnetic brain pulse treatment. Before I begin, I am very excited to introduce my co-presenter, Dr. Judy Kosterman. Dr. Kosterman is the co-founder of the Brain Health Leadership Foundation and has spent many years working in the prevention, intervention, and treatment of mental health and substance use disorders. For a bit of background, the electromagnetic brain pulse treatment, otherwise known as EMBP, uses various medical devices to uniquely image electrical activity in the brain, identify areas that may not be functioning properly, and most importantly, stimulate the neurons with the goal of restoring optimal brain functioning using a non-invasive, non-pharmaceutical method. In recent years, research has shown this treatment can effectively treat neuropsychiatric disorders, including major depressive disorder, anxiety, as well as substance use disorders and addiction. Chair Brown-May, we have a conceptual amendment that changes the intent of the bill as it was written to focus on expanding access to EMBP treatment. This amendment is available to the members and uploaded to Nellis. The bill, as originally written, requires the pilot program to study best practices, compile relevant data, analyze risk, and examine barriers. Since the United States Food and Drug Administration has already completed much of this work, the amendment shifts the program's focus to expanding access to EMBP to treat people with post-traumatic stress, substance use disorder, and gambling disorder. I will now turn it over to Dr. Judy Kosterman to provide a more in-depth presentation on her amazing work and the conceptual amendment. But before I give it to her, you have no idea how excited we are. We were joined together by Assembly Member Natha Anderson. I had an idea that I would like to see this work come to Nevada, and Dr. Kosterman was looking for someone in the Assembly to bring this to light. And Natha put us together. So kudos to Assembly Member Anderson. Go ahead.
Well, good afternoon, everyone. I'm really excited to be with you. Thank you, Madam Chair, and thank you as well for the introduction. I am here today because I'm probably the most excited person in the world, and in the room for sure. This is a protocol I want to talk with you about that I've discovered on a journey that began first as an educator, working in academic settings, and becoming actually more and more concerned and ultimately intrigued by what was going on in the barriers to learning as I was in the academics of learning. And that took me on a completely different quest that I had never intended. When I was dealing with high school kids that had mental health and substance use and other problems that were really detracting from their ability to do well in school, but really stealing their lives. And so that's really where my journey began. It was much later in the journey that I found myself moving from Washington State to the capital of the country, Washington, D.C., and working there with military who were returning warriors from Afghanistan and Iraq. It was then that I met a neuroscientist who began to really answer the questions I had had along a long journey that took me from education to the drug czar of a state to a White House position and working with the military. When he talked about this particular protocol, I came from a behavioral health frame of reference. This is a medical frame that I'm sharing with you today. I want to say, before I click through these few slides, that this does not in any way intend to detract from, displace, replace, or dismiss the importance of behavioral health treatment. This just brings another tool to the box that works from the medical side that can actually change the brain, making it more receptive to all of the other. So we're going to talk about electromagnetic brain pulse, thinking about all of the things that we just mentioned: post-traumatic stress disorder, substance use disorder, gambling disorder. Then there are others as well, of course: OCD, anxiety and depression, attention deficit disorder, traumatic brain injury, and the list gets even longer. So the question is always, what interventions really do exist to treat these conditions? And by and large, there have been two: pharmaceuticals and behavioral health therapies. But as we look at that long list and we think about all of these conditions, my question is, what's the common denominator? We talk about brain health and brain science, but we really often don't talk about the brain itself. And for me, that became really the question. What about that physiological thing between our ears and how it actually works in a physical way? So what if we could address that? The answer is today, yes, we can. Actually look at the brain itself and what it needs, what we can do for it and with it that can change the picture. As was mentioned, this protocol is non-pharmaceutical, non-invasive. It's a medical intervention that begins with two Class 2 medical devices. One is EEG. That's a swim cap looking thing you put on your head with wires that come out of it that gather all the data going on. And then once we have that data, we can then talk about with you, the patient, and others that you might bring to such a meeting, what's going on between your ears. That's just an amazing thing all by itself. But then the question becomes, what do we do about it? So if you think for a moment of your brain as an information processor, like the radio in my high school 62 Ford Falcon, you can appreciate that we used to dial in a station where we would hear the music we wanted to listen to, and if we were not right on the dial, 102.7 or whatever it might be, not only did we not hear the music, but we heard static. And the same is true of the brain in its information processor. If we are not dialed to the frequencies in their normal ranges in your brain frequency fingerprint, then whomever has frequencies that are off will not have the beauty of the music they're trying to hear, but rather static. In brain terms, that's really symptoms of different kinds. So we sit someone in a chair with that wonderful cap I was describing, and then we gather the data that's going on in brain frequency terms using an EEG, and a very sophisticated EEG analysis is done that not only tells you that you're dead, alive, or have had a seizure, which is the normal use of it historically, but today we can really see all that's really going on in frequency terms in your particular frequency fingerprint. And we learned two things: the state of it today and also where it really should be. And then we use a second step that takes those data and evaluates them and then feeds the data to a second device known as TMS, transcranial magnetic stimulation. It's a device been around since about 2008, and this is now today in 2025. So there's been lots of improvement, lots of advancements with this particular device. And today, we use that device guided by EEG to nudge your neurons into the places where they should be for you and your normal optimal frequency fingerprint. So in both cases, you sit in that comfy chair we're talking about. In this case, an electromagnetic coil is going to be placed on your head, and in a 30-minute period, you're going to be experiencing stimulation, moving those neurons. This wheel describes the process from start to finish: EEG and evaluation, analysis and determination of your individual protocol, delivery of that protocol, and then progress evaluation using subsequent EEGs that give us the observable and objective data at the same time that you are reporting each time you're in for that 30-minute session with a technician what's going on for you in terms of your clinical response, how you're feeling. And we're looking at both. They're equally important. The history of this, beginning in 1987, has gone through these iterations that I alluded to. But today, beginning in 2020, coming out really of COVID, the most advanced version of this protocol exists. We at the Brain Health Leadership Foundation, a nonprofit, have been interested in these advancements, looking around the world at what's really going on. The reason I'm here today is because we really believe that this is the most advanced medical form of treatment, non-pharma, non-invasive, that can literally change how brains work. We've done lots of things to try to validate this protocol. Some of them have been here in Nevada, so let me just speak to those very quickly. There are published clinical trials and studies and scientific white papers that have been done not only in the US but worldwide. Here in Reno, Nevada, northern Nevada, 3 things are underway. Pilot program that has been done, funded through our foundation, then contracted to a provider of this protocol. Through Washoe County specialty courts, we've been treating individuals seeking recovery who have mental health, substance use issues, find themselves somehow interacting with law enforcement, which is what takes them to court. Through the court programs and specialty courts that are alternatives to incarceration, they have behavioral health protocols. Through this pilot, we've been able to bring this medical protocol. We've just finished that pilot. We're crunching those data right now, and the next time you see me, I'm going to have them. We also began, through a private grant, the treatment of Reno City Fire Department first responders. That's not yet completed. We were given, once again, through the nonprofit foundation, that grant to allow us to treat a certain number of them, and that is underway. And then most recently, because of their seeing all of these things, Prominence Health Plan, the regional version of universal health care, and in partnership with the Reno Sparks Chamber of Commerce, have an association health plan. And that ensures small business owners in Northern Nevada with 50 or fewer employees to be a part of that insurance group. And they, beginning this month, actually, are beginning to reimburse for this protocol for members of their association health plan. That's what's happening here. These are 2 clinics here in Nevada, one here in Reno, one here in Las Vegas, that are already licensed to provide this protocol and are working not only with patients every day, suffering from the conditions that were listed in which this bill really speaks to, but many others, from autistic children to elders facing dementia and Alzheimer's. And I'm going to leave it at that, and I don't know what happens next with somebody who's going to testify. We'll let them do so. Thank you.
Assemblymember Venice Karras for the record. We are now ready for questions, which I'm pretty sure Dr. Kosterman is going to be answering.
All right.
Thank you for the presentation. We do have questions. We'll start with Assemblymember Hornlicker.
Thank you, Chair, and thank you for informing us about this kind of treatment. It sounds great, and I'd love to have us fund a pilot program. My concern is we don't have an unlimited budget for funding medical research. And so if we fund proposal A, we can't fund proposal B or C. And I'm guessing there are lots of worthy unfunded proposals out there by other groups at our medical schools. Are we the right body to be making the decisions about which pilot programs are funded?
It's Judy Kosterman again. This would not really be so much a research effort because research has been done. And so much so through FDA and all, clearing these devices and also having the AMA protocols existing, the AMA CPT codes exist currently to bring this to the market, the medical marketplace. And that has been going on for several years. What this would do here in specific would be to focus directly on the chief indication concerns of post-traumatic stress, of substance use, and also of gambling disorder, and to actually prove the protocol in those areas in this state. Any new protocol that's happening is always seeking some way of furthering its proof of concept, but this is far beyond a concept, far beyond a research step. Everything that is done through this protocol has been declared by FDA to be low or no risk. These 2 devices are not problematic in any such way, needing their safety assured or anything like that. It's simply about how does this work to this specific condition.
Yes, but if you would stay with the policy and not the finances, I'd appreciate that.
Well, I'm not, at the risk of, I'll try to avoid money, but proof of concept comes up with a lot of things. A drug's already been approved, and now a researcher thinks, oh, we have another indication. So we still have to, are we still the body to sort out those kinds of choices?
Judy Kosterman again. I agree that there is that. This is protocol that is in existence worldwide. Just in some indications, there have been over 20,000 individuals already treated by this protocol. So it's not so much about our need to prove its effectiveness as it is to show you how effective it is and how it works to the issues that you have and that do, in fact, cost you money. I heard that little bit of that discussion. This is the kind of thing that we want to be clear comes with CPT codes attached, which is why Prominence is now involved using theirs to reimburse for this, but also that there are other payers, whether they're the self-insurance of a city or a university or the other private payers, not to mention government insurers as well, Medicaid and Medicare. So that's one of the ways that we really want to assure that in this country, access exists, because here we pay for our health care through our insurance as opposed to our wallet directly. So it's really more about that particular effort in this particular state.
Thank you. Members, I'll just remind you, we do have another money committee that does a deal with the financial aspects of any of the policies that we consider. Ours is the policy committee consideration, right? So I would ask that we just be conscious of that as we're asking our questions, knowing that there would be another hurdle should that we decide that this is a policy worth pursuing as a committee. There would be another committee that the financial aspects would then go through. I appreciate the concerns from members, though, relative to the costs and such that we are in such a budget constraints currently. So know that I appreciate those questions. Next question we have from Assembly Member Nadeem.
Thank you, Madam Chair. Thank you for the presentation. My question is, with these two devices, EEG and TMS, when we use on a patient who has an addiction problem or a depression patient, so how much difference does it make if we use these devices and change the neurons, move the neurons, and without using these devices? Do you have any data that how quickly they improve a patient?
Judy Kosterman, one more time. We do. In fact, we do have measures that have been done in...
Microphone went off.
Okay, there we go. Research that's been done in clinical trials. There is research on different indications that are making those measures. And there is also, the opportunity to see patients in clinics throughout this country and elsewhere. So we have those data as well. One of the things that we know, and I'll just cite quickly, a trial on post-traumatic stress, which is an interest here. So that particular trial, clinical randomized placebo-controlled trial, was treating veterans. And they had all been to the VA, every participant in the trial. They'd been diagnosed with post-traumatic stress. They had received every form of treatment the VA had to use to treat that particular indication. And they came to this trial, in their words, suicidal, not yet really having any relief. So the trial begins with each of them believing they're being treated, but only half of them really having that experience for sure. The others were the placebo group, sitting in a chair, going through the treatment session, but not really receiving the protocol. In 2 weeks, that's once a day, each day for 5 days, so 10 days total, of the 30-minute protocol, which is stimulating the brain just 6 seconds of each minute through that protocol. At the end of 2 weeks, there was so much difference between those two groups. First of all, they were all aware of it. I'm sleeping. Oh, you're not sleeping? I'm sleeping. Why? Yeah, they were having these conversations. And the IRB, this board that controls human subject safety in a trial, said you can no longer withhold this protocol from the untreated group. So all were treated for their post-traumatic stress over 4 weeks. That was the dose they each got. At the end of 4 weeks, they went from highly symptomatic to no longer symptomatic on the same measures used by the VA, on which they'd not moved a point. On average, they moved 64% in terms of their symptoms, and completely changed their diagnosis, as a matter of fact. You bet.
Thank you. Dr. Kostman, I wonder if you would share some of the outcomes in data form with the committee that they may have a look.
Absolutely.
Thank you. Next question we have from Assembly Member Edgeworth.
Hi, thank you for bringing this to us. I'm always interested in new technology and new ways that are non-invasive to help people. And I do believe that our decision-making should be evidence-based, as I'm sure you do. So I appreciate that it's safe. I appreciate that there's a CPT code, that the FDA has approved it, that it's not very dangerous. Do you have more data? I see that you're saying in treatment-resistant people, it's highly efficacious. But have there been large-scale things for the general population that are double-blind, that have a good p-value?
So there have been. Judy Kosterman again. Thank you very much. There are multiple trials and studies. I'm happy to provide you with them. Some are peer-reviewed and published. Some are not. There's both categories. But what we also know in just bringing this protocol to the general public, two things. We know that working with it in the military, so at the end of the trial I just mentioned, 2017, this went into the Department of Defense. It's been there ever since. They've also published their own publications related to the ways in which they're using this that range from reduction in substance craving to post-COVID long haul. It's been very effective with that, to other things. Others have also been using this protocol in different ways, and they have made other publications available. I'm happy to give you as many publications as you may choose from the history of this work, whether the indication has been, schizophrenia, major depressive disorder, PTSD. There are such publications available, and white papers as well, describing particularly the most advanced form of it. That white paper is really differentiating what this is from other use of TMS throughout the medical market.
Thank you. I would appreciate any data you have on what you're planning on doing. So on the diseases, PTSD or gambling disorder, in the general population, unless you're planning to treat treatment-resistant people or veterans, I would appreciate data that would apply to exactly what we want to do here in Nevada. Thank you very much.
Yeah, I appreciate this, is Judy again, Judy Kosterman. I appreciate your interest in this specifically. We're also interested in it specifically, and I'll share with you what we currently know and have, and we'll go from there.
Thank you. Next question we have from Assemblymember Gray.
Thank you, Madam Chair. Dr. Kosman, good to see you again. It's hard to believe it's been 30 years since we worked together when you worked for the president, but here we are. Thank you for bringing this. I'm always a fan of treatment, especially non-invasive treatment for veterans. Just real quick, couple of real quick questions. One, what's the approval for this device? Is it a 510K or is it a breakthrough device program device?
The devices, Judy Kosterman again, I'm so sorry about that. Yeah, it's okay. The devices that are in the market, so a TMS device and an EEG device, have been fully FDA not only cleared but approved, indicated for years, one since 2008 and one probably 80 years. So there's nothing new in the FDA approval of those two devices occurring right now, other than the fact that we're using a platform that's technology driven so that this can be scaled around the world. So historically it was one guy reading an EEG, creating the evaluation, then developing the protocol and taking it to a patient. That's no longer the case. Today, using technology, the data from the EEG are fed into an evaluation, into a cloud system that does that evaluation. The protocol is determined, a report is produced for the physician working with that patient, and it automatically is fed in to the TMS device for that individual patient. So that's a technology protocol, not a treatment device, and that protocol is in FDA currently, as are many as they're working through that process of just the protocol, the platform it's really called at the FDA level. So that is 501. So that's in that process currently. That allows us to scale this with 4 servers that back one another up worldwide to assure that this protocol is doing what we want it to do with patients all over the world in the civilian population. Thank you.
Madam Chair, can I have a quick follow-on on that one?
Go ahead, follow up.
Thank you. Dr. Kosterman, now do you see this being, we'll go back 30 years in our lives, do you see this protocol being expanded to things like drug addiction or other kinds of addiction where it'll help with those as well?
Judy Kosterman. Absolutely. In fact, that's been my primary interest, as you know, having known our work in counter-drug at the military level. My interest is probably primarily come from that particular issue. It's it's always a secondary issue, never a primary one, so there are things to be considered that drive it for sure. But even in our PTSD trial with veterans, that was a singularly focused, one variable, PTSD, on which we were looking. But in that particular trial, these men, mostly men, a few women in that trial, were also stopping or reducing their use of drugs and alcohol. So we did a retrospective analysis of that. We have those data as well, but we saw amazing change to their substance use through this protocol. You know, in sort of philosophical, maybe not so scientific terms, you know, we might think about just the fact that if we can change whatever it is through that is disturbed in some way in neuron terms, that they get moved in some way and they're not functioning where they should be, that we then have symptoms. If we can change that root of the tree, the neuron itself, then we can change the symptoms people are struggling over a long list of indications. I'll make one other comment. Prominence in their effort right now to reimburse for this, I believe, are reimbursing for over 10 conditions that they identified, believing that it will be helpful to that entire list. The things we're talking about here in this room are also on that list. So we'll continue to learn more and gather additional data on all such things going forward.
Thank you. And again, thank you to you and Assembly Member Karras.
Thank you.
Thank you. Members, any other questions? No, I do have one. I have just one, if you don't mind. If I look at we're looking at the amendment, the conceptual amendment that was presented, not the bill that we originally presented. And it simply states that the Department of Health and Human Services shall create a pilot program to study the effects of these treatments. You have presumably good data that supports why we would have this treatment protocol in the first place. Why is this important for the Department of Health and Human Services to create a pilot program? Why are we pursuing Nevada revised statutes to do this?
Judy Kosterman. I think that ultimately access for patients is the most important thing. So with any opportunity to bring forward such work and to make it available to patients, then we can increase the probabilities for third-party payment nationwide. That is the barrier to anything in the medical marketplace. Things that are approved and have been for years, just people are still fighting through, getting their reimbursement for all kinds of conditions. These three conditions were really raised by my Assembly member sitting next to me as concerns in this state from her perspective, and that's why this focus is really what this bill is looking at in specific. Does that answer your question?
Thank you. I appreciate that. Okay, seeing no other questions, at this point we'll ask you to step back. And we will now move into testimony in support of Assembly Bill 304. I do understand we have someone on Zoom. I believe that they may be here to offer. If you are here in support, we will go ahead and start with you. If you are here in support in the room, please come forward. You may fill in the chair. Same thing with Las Vegas. Thank you. Go ahead. We'll start on Zoom.
Thank you. Can you hear me okay?
I can. Please state and spell your name for the record, and then you'll have 2 minutes.
Thank you, Assemblywoman. My name is Corrado DeGasperis, Corrado, first name, last name Degasperis. I am the Executive Chairman and CEO of Comstock Inc. I've been a Nevadan for 15 years, currently living in Gold Hill. And as an executive of a public New York Stock Exchange listed company, my short story really starts with I just work very, very hard, frequently 7 days a week, 18 hours a day. And when I first met Dr. Judy Kosterman 10 years ago, I was just more curiously enthralled by the treatment, and I submitted myself for an EEG. I think at that time, certainly more out of curiosity than need. At the time, I was delighted to get a good feedback report on my brain. I fed my ego a little bit to be complimented about the functionality of my brain. And at the time, I would have considered myself a casual drinker. I'm not sure what others would have thought, but surely I would drink alcohol every weekend, oftenly, heavily so. The next 5 years of work after that meeting, my work increased and the stress of my work increased dramatically, and my level of drinking steadily increased, effectively becoming daily. I recall being at a low point with the amount of drinking and the fatigue, the stress, and frankly, just becoming less and less reliable to everybody around me. Judy counseled me. I recall her saying that people drink only for two reasons. Either they're thirsty or they're seeking a feeling. And that latter part sort of hit me like a punch in the nose. At that time, I resubmitted for treatment. I got another EEG 5 years later and was shocked when the diagnosing doctor said that he thought he was looking at the brain of somebody that.
Pardon me, I'm sorry, I don't mean to interrupt you, but you're over 2 minutes currently. If you wouldn't mind, we'd love to receive your comments in writing, or you can wrap currently.
I'll wrap. I'm just done. Yeah. So my brain was in bad shape. I submitted for 6 weeks of treatment, and I haven't had a drop of alcohol in the last 4.5 years. So I thank everyone for listening and caring for this help to go to others. Thank you very much.
Thank you for your comments, and thank you for being here. Thank you for sharing your story and your vulnerability. We appreciate you. Thank you. Okay, you may begin here.
Madam Chair and members of the committee, Amy Sjogren, that's Shogren, with Black and Wadhams, representing the Nevada Hospital Association today, here in support of AB 304. This is a very interesting treatment to study, and we look forward to additional conversations and learning more from the bill sponsor. Thank you.
Madam Chair Brown-May, Vice Chair Nguyen, Assembly members, my name is Jason Rich, R-I-C-H. I thought I was going to have another minute 30 to prep. She went pretty quick. I'm a former Navy SEAL, went into the teams around 1998, served till about 2003. Went into the teams happy, healthy, raised by a true village, Schatz's, Wasser's, Smar's, my own. I was very well taken care of. By the time I got out of the teams, I'd been blown up, pinged, overpressured by rockets. What else? Oh, I fell out of a helo. Knocked up my noggin pretty good. Several TBIs because of that. PTSD. Had never lost anyone in my family when I was coming up young. Third day at the team, first guy comes back in a casket. How do you deal with that? I didn't drink or drug prior to going to the teams. How do you deal with that? We did a 3-day wake, drank my face off. That became the standard. I looked up to the older guys. If you could drink 4, I could drink 5, 6, 7. That became the standard for my time in the Navy. When I left the Navy, I had nothing but static. If you recall the presentation, both front and rear, on about 1,000%. And that lasted up until 2021 when I had a suicide attempt after slapping my son, which landed me in camo court. Put in a lot of work on my own through the program, was associated or referenced to EMBP, sat with Dr. Huerta, who gave me an EEG baseline, showed me what it was, and after my treatment, what it was. Best sleep I've had since leaving the teams. I can completely support not only the bill, but the treatment. Thank you for your time.
Thank you for sharing your story. Thank you for being here. Go ahead.
Good afternoon, Chair Brown-May, members of the committee. For the record, my name is Nick Schneider, Director of Government Affairs for the Vegas Chamber. The Chamber is in support of AB 304 as amended. We believe this program to be a valuable way to study the efficacy of EMBP treatment in a number of very prevalent mental health care issues throughout our state. And the data collected could be highly valuable into further developing the industry within our state. We ask for your support. Thank you so much.
I'm Jeff Hadwick, excuse me, Jeffhadwick. I'm here representing Jeff, not Epic Brain Centers, that I'm now the clinical director of. I was a patient first, played college and pro football, had post-concussion syndrome, chronic illness, and got addicted to pain medication. I was naive to the power of pain medication. I didn't need it until I got diagnosed with Crohn's disease in 2010, had a total hip replacement in 2011, and my wife asked for a divorce in 2012. My life evaporated in front of me and became suicidal in 2013. And rather than doing that, as I was a Washoe County school teacher, I knew the power of suicide because I had 2 young daughters and I couldn't do that to them. But I couldn't alleviate the pain. Antidepressive, anti-anxiety medication wasn't working. The hours and hours and hours of behavioral therapy that I had didn't work. I knew what they were telling me because I have a master's degree, but it wasn't effective, and I had no other solution except pain medication. And I rode that till the wheels fell off. I became homeless. I'm a 4-time felon, spent 18 months in jail. Needless to say, I'm the story of a lot of stories that are out there. I should know better. I'm smarter than that. But drugs don't care. And so I was devastated. And fortunately for me, I committed a crime, and that saved my life. It was where I was introduced to Judy Kosterman and the treatment. I underwent treatment, went to Reno Sparks Gospel Mission, changed my behavior through the mission, and the treatment changed my brain. And that was many years ago. And it changed so much that I needed to be a part of it, because I knew NFL money and all the things that come with it, cars and fame, led me to the doorsteps of NAMS wanting to commit suicide. And so I had to find a different solution, and I wanted to be a part of it because it was so impactful on my life. And today I sit in front of you as the clinical director of Epic Brain Center, and I see these miracles every day. Thank you.
Thank you. Thank you for sharing your story and your vulnerability as well. Is there anyone else here in Carson City in support of Assembly Bill 304? Please come forward if you are. Anyone in Las Vegas here in support for Assembly Bill 304? I see no one moving in Las Vegas. You may begin when you're ready.
Good afternoon, Madam Chair and members of the committee. My name is Jalen Wise, Jalen, last name Wise, WISE, with Silver State Government Relations. Testifying on behalf of the Nevada Opioid Treatment Association, or NOTA. And NOTA supports the aims of AB 304 in furthering the accessibility of electromagnetic brain pulse treatment, as it would be of great use to treating substance abuse disorders. In early clinical studies, results show that the mechanisms of repetitive transcranial magnetic stimulation, or RTMS treatment, in addiction are becoming more understood as involving increased dopamine and glutamate function in mesolimbic brain circuits and modulation of neuroactivity in brain circuits. That is to say that these effects address the cognitive processes relevant to addiction, such as response inhibition, selective attention, and reactivity to drug-associated cues. Additionally, John Firestone, president of NOTA, wants to remark that he knows Dr. Judy Kosterman well and gladly supports her efforts in making this happen for Nevadans. Thank you for your time.
Thank you. Is there anyone else here in Carson City in support of this measure, Assembly Bill 304? Seeing no movement here and no one at the table in Las Vegas. AVH, is there anyone on the telephone line in support of Assembly Bill 304?
If you would like to testify in support of Assembly Bill 304, please press star 9 or raise hand in your Zoom window to take your place in the queue. Again, if you would like to testify in support of Assembly Bill 304, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Chair, there are no callers wishing to testify in support at this time.
Thank you, AVH. Now we'll move into opposition testimony. Is there anyone here in opposition for Assembly Bill 304? Please come forward at this time. Seeing no movement here in Carson City. Anyone opposed in Las Vegas, please come forward. Seeing no movement in Las Vegas. AVH, is there anyone on the telephone line in opposition for Assembly Bill 304?
If you would like to testify in opposition to Assembly Bill 304, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Chair, there are no callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. Is there anyone here in Carson City who would like to offer testimony in neutral on Assembly Bill 304? Seeing no movement here in Carson City. Anyone in Las Vegas who would like to offer neutral testimony on Assembly Bill 304? No movement in Las Vegas. AVH, is there anyone on the telephone lines who would like to offer neutral testimony on Assembly Bill 304?
If you would like to testify in neutral for Assembly Bill 304, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Chair, there are no callers wishing to testify in neutral at this time.
Thank you, AVH. We'll invite the bill sponsor back up for closing comments if you'd like.
Denise Karras for the record. I just want to thank the committee for their interest and their good listening ears for this one. There's a few things I do also want to say that Dr. Kosterman in her total humble attitude didn't mention. But there were reasons why I wanted to bring this forward, and the minute I met her, I was so excited about it because you can't match the two of us together on how exciting we think this is. I know she didn't play a lot on one of the big concerns in Nevada, which is gambling addiction, and that she very lightly covered how many people she's helped. She asked me how many people she would like me to have her bring for testimonials, and I said, just bring a couple so we're not here all day. But she literally could provide hundreds of people. They're all very thankful, and this process is amazing. It does work for gambling addiction also. So for our state, between substance use disorder and gambling and anything else we can think of to use this for, I think it's in the best interest of every citizen of our state. Thank you.
Thank you. And we will now close the bill hearing for Assembly Bill 304. Okay, members, next on our list, we're going to move into Assembly Bill 315, and we will invite the bill sponsor to the table. Please take your time. I'm happy to open the hearing for Assembly Bill 315, which requires applications to participate in Medicaid as a provider to be notarized. You may begin when you are ready. Please state and spell your name for the record.
Thank you. Assemblywoman Rebecca Edgeworth, Rebecca, Edgeworth, Edgeworth. Good afternoon, Chair Brown May and fellow members of my committee. I'm Dr. Rebecca Edgeworth, and I have the honor of representing Assembly District 35, which is in Southwest Vegas. Thanks for the opportunity to present Assembly Bill 315, which aims to address the growing issue of Medicaid provider fraud. I'm pleased to introduce two presenters, actually the two people who gave me the idea, which are right there, the very professional-looking gentleman in Las Vegas. And also, that's Matthew Ross and Andrew Schulke. And additionally, we have the administrator, Stacy Weeks, here. And they're both available to answer questions and kind of go through the bill a little bit. They're here to explain the language and the implementation of what I'm talking about, but they are not here in support or in opposition. They're going to be in a neutral just because of their position. So, For background information, we heard in the joint meeting of our Senate with our Senate colleagues that Medicaid provider fraud is rampant, and it costs the state and the federal government an awful lot of money each year to the tune of millions of dollars. According to the most recent annual report from the Healthcare Fraud and Abuse Control Program, which is national, civil healthcare fraud settlements and judgments under the False Claims Act exceeded $1.8 billion between 2022 and 2023. So we're talking about a lot of money nationally. And just to be clear, we're talking about fraudulent providers. We're not talking about chasing down Medicaid patients. That's not what this is about. It's about people who are perpetrating fraud and acting as though they are providers. So it was brought to my attention, again, by these two gentlemen, that the process for signing up to be a Medicaid provider is currently largely an unverified process. So, for example, you guys right now could go to Google and you could type in Dr. Rebecca Edgeworth and then type in NPI number. That's a unique number that I get as a provider. It's public information. It'll pop right up. You could complete the application process to be a Medicaid provider, pretending to be me and not actually me. Then you can start billing, and then by the time they figure out that it's not really me, then trying to get the money back or trying to catch the perpetrators can all be very difficult. We are just trying to make this process a little bit better by requiring a verification of the person's identity before they sign up as a provider. So there's a couple different ways to do that, and we're going to talk about that. I think everyone can probably agree, it feels like this is a bipartisan thing, that we want our Medicaid dollars to go to populations who need help and not to criminals. That's what I would say. Seems pretty straightforward, right? Okay, good. So I will have, you guys, you fellas can head up to the table there. There you are. Thank you. So again, not in support or opposition, but in neutral. I'll have Matthew Ross and Andrew Schulke give some background and discuss the bill specifics.
Good afternoon, everybody, and thank you very much for the opportunity to talk today. My name is Andrew Schulke, for the record. I am currently the Chief Deputy Attorney General and Chief/Director of the Medicaid Fraud Control Unit housed within the Attorney General's office. And yes, as Dr. Edgeworth just finished saying, we are in a neutral position, but the language essentially being added to this bill, we can say would be of great help in how we prosecute or handle these type of cases. And obviously, we're here to answer any type of questions that you might have specific to the Medicaid Fraud Control Unit. Thank you.
Rebecca Edgeworth, for the record. Just to let you know, there is the bill, which I'm sure you have in front of you. There's also an amendment that's in Nellis, or you might have picked up a copy here. That amendment was added by Stacy Weeks, who both ends of it, both people were working on this kind of at the same time. So Stacy Weeks can address what she wanted her amendment to be. Hopefully everyone has a copy.
Madam Chair, Stacy Weeks for the record, Nevada Medicaid. Yes, signature verification has been a challenge for us at the division. We do not currently have anything in state law that really enforces that. We recently had a provider actually threaten us and actually calling our staff about even asking them to submit a signature, not even verify it. So this legislation will be helpful. It's one more tool in our toolbox to ensuring that we are at least stopping bad actors from entering the program. Sometimes you still have valid actors who later enter the program and then commit fraud. So this is one helpful tool. The amendment in front of you also recognizes some of the work we've been trying to do in our program to allow for electronic verification of a signature. As you guys know, we often are told applying and enrolling in Medicaid is challenging and providers often give up. And so we're trying to make this online process better. We have a provider revamp, is what we're calling it, that goes out, starts this fall. And part of that will be this new signature verification process. We're looking at using biometric data and other tools online to try to get a verification. So having both the notarization option and the electronic identity verification was one of the reasons we came to talk to Dr. Edgeworth to ensure that the work that we've been already doing can continue and be supported by this bill. Thank you.
Thank you. So just to be clear, the people who might be a little bit against this would be my people, physicians. And it is a lot to need to do, but to prevent millions of dollars worth of fraud, I think it's a very worthy thing that we should be pursuing, to be fiscally responsible for what's going on in our state. With that, we can have questions. Anybody has any questions?
Thank you. First question from Assemblymember Gonzalez.
Thank you so much for your presentation, and thank you, Chair, for the question. I definitely agree that this is an issue in our state. Sorry, I just wanted, if you could walk me through the process again. So you were saying that somebody could go online and pretend to be you and get this process. So I guess my question is, what other things could we do to prevent this provider fraud?
Madam Chair, Stacey Weeks, for the record. I just want to be clear. To enroll in Medicaid, you don't just need to put your name in and your MPI number. There is an application. We do ask for documentation, ownership, but people are very, savvy in fraud. And so having this verification is an additional tool. So especially for criminal fraud, it helps our AG's office when they take on some of these cases. Not every case that we have is taken on at that level. But if it is, this also gives them the ability to prove that this individual really did enroll and commit this fraud. So I think that is the other piece of this. We do have civil fraud as well, and we do get rid of folks pretty quickly if we see that, but there are some other efforts that where this, I think, will be even more helpful.
Thank you so much. And then I was curious, can you speak to the number of cases of fraud that you guys have every year?
Madam Chair, Stacey Weeks, for the record. Oh, go ahead.
No, Stacey, please go ahead.
Yeah. So I was going to ask if Cynthia Leach could come up and speak to that, who's over our surveillance and utilization review program.
Hi, good afternoon. Cynthia Leach for the record. We refer to the MFCU roughly 45 cases of credible allegation of fraud a year. That seems like a really low number. That's just fraud. We don't actually identify fraud or investigate fraud. We do identify it, a credible allegation of fraud, and then we refer it to the MFCU. So I think either Andrew or Matt might have better statistics on the actual number of cases of fraud and what they've convicted people on.
Thank you. If you would go ahead and, if you have the data, that would be great for you to share. Also, could you please explain the MFCU for members, just so we get that on the record?
Cynthia Leach for the record, MFCU, Medicaid Fraud Control Unit.
And if I could, Madam Chair, I can address the follow-up questions. Andrew Scholke for the record. Yes, we do have essentially, because we operate to a certain degree under a federal grant, we have a number of different reports that we make. I think the one that would address your specific question, Assembly Member, is we have an annual statistical report, ASR, that is published online by the Federal Office of Inspector General, OIG, Health and Human Services, and it does provide those kind of information, like number of convictions, number of civil settlements we've had. I believe it has the number of cases that we've done in that. Now it is based on federal fiscal year, so we might have a calendar issue. But if there is something you need more like a regular calendar year or a state fiscal year, we can definitely provide those numbers. I do not have them off the top of my head, but they are definitely out there.
Thank you. That information would be helpful if you don't mind sharing with our committee secretaries. We'd appreciate that, and we'll distribute with our members.
Absolutely.
Thank you. Members, any other questions? Oh, Assemblymember Jackson.
Thank you, Chair. Thank you for the presentation. Just want to get the specifics. When a provider is already enrolled, and will they have to do a notary to be attached to another agency, or is this just for the initial application?
Cynthia Leach for the record. Thank you for the question. The process that we're putting forth in our new revamp system is that when a provider enters into the program and enrolls, that the liveness verification, which kind of replaces the notary signature, will be required for both the application, the provider agreement, and the contract.
Follow-up, Chair. Will there be any mandates to the actual provider organization or the entity?
Cynthia Leach for the record. All owners will have to sign the contract and go through the liveness process, which is a facial scan that gives you a photo ID it verifies the actual identity of the sender, and then it gives us an audit trail of who was there, that they were present when they signed it, and that we could use for audit and investigations for the MFCU.
Thank you. Members, any other questions? Okay, seeing none, we'll ask you to step back. We will now open up for testimony in support of Assembly Bill 315. If there's anyone here in Carson City in support of this measure, Assembly Bill 315, please come forward at this time. Anyone in Las Vegas? Not seeing anyone in Las Vegas. Not seeing anyone here in Carson City. AVH, is there anyone on the telephone line in support of Assembly Bill 315?
If you would like to testify in support of Assembly Bill 315, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Caller, you are unmuted on our end.
Yes, this is Diego.
You may begin.
It's Diego Trujillo, D-I-E-G-O. Last name Trujillo, T-R-U-J-I-L-L-O. I want to say thank you very much for the Assembly for looking at this bill. One of our prerogatives as the CEO of Las Vegas Heals and founder and president of Vegas Healthcare, we're a coalition that stands and represents providers here in Las Vegas. And so we really wanted to take a stand in favor of this bill, to stand with providers in our state and to help stop fraud. Since we've had Andrew and Matthew presenting to the community, we've had a lot of the community coming and sharing how they watch the fraud rings and people move into our community. So I'd say I'm very grateful for this bill, and thank you to everyone that is in support.
Hello, can you hear me?
We can, go ahead.
Matthew Cox for the record, COX. I am in support of AB 315. I'm with Vegas Heals. I do run and support their mental health coalition. So thank you for your time, and I just wanted to kind of back what Diego said and support.
Hello, good afternoon, Chair Brown-May, Vice Chair Wynn, and members of the Assembly Health and Human Services Committee. My name is Jacqueline Wynn, N-G-U-Y-E-N, and I represent the Nevada State Medical Association, the oldest and largest organization representing physicians in our state. Physicians and other providers in the state are used to doing more with less in the state, and that's not right. We absolutely want all available dollars to go towards patient care, and therefore we're fully in support of AB 315. Thank you so much.
Chair, there are no other callers to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition. Is there anyone here in opposition for Assembly Bill 315? Please come forward in Carson City. Seeing no one else in Las Vegas. No one moving here in Carson City. AVH, is there anyone on the telephone lines in opposition of AB 315?
If you would like to testify in opposition to Assembly Bill 315, please press star 9 now to take your place in the queue. Chair, there are no callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. Is there anyone here in Carson City who would like to offer testimony in neutral on Assembly Bill 315? No movement here in Carson City. Seeing no one in the room besides our two presenters in Las Vegas. Lovely to see you again. AVH, is there anyone on the telephone line who would like to offer neutral testimony on Assembly Bill 315?
If you would like to testify in neutral for Assembly Bill 315, please press star 9 now to take your place in the queue. Chair, there are no callers wishing to testify in neutral at this time.
Thank you. We'll invite the bill sponsor back to the table for closing comments.
Thank you, Chair and committee members, for your consideration of this bill. Short and sweet.
Thank you. At this point, we will close the hearing on Assembly Bill 315.
All right, so we're going to play musical chair for a minute, and we're going to have our chair go down and get ready to present the next bill. I'm sure you have 50 questions for her. So we will now open the hearing on Assembly Bill 284. That requires the Director of the Department of Health and Human Services to seek to establish certain rates of reimbursement under Medicaid for certain devices to treat epilepsy. And we welcome our awesome chair to the other side of the dais. And Chair, can you go ahead and ready whenever you're ready?
Thank you. Thank you for the opportunity to present today. For the record, my name is Tracy Brown May. I'm proud to represent Nevada Assembly District 42 into the Committee on Health and Human Services, so thank you for your time and attention today. We are here to present Assembly Bill 284, which requires the Director of the Division of Health and Human Services to seek to establish certain rates of reimbursement under Medicaid for certain devices that treat epilepsy. So I want to first call attention to two gentlemen that I have with me that will be available to answer questions later. Mr. Matt Driscoll with High Desert Strategies, he's on this side of the room, and Mr. Paul Young, who is a partner with Tom Clark Solutions. This is where the bill idea came from. These two wonderful advocates in support of many of our patients here in Nevada that require what's called a vagus nerve implant. So during the 2023 session, I received a call from a constituent asking for medical help. I took the call from the lobby of this very building. It was the only place that my phone actually went through. Sarah Brown had seen her doctor and was told that she needed a replacement for her vagus nerve implant. Okay, this is Sarah. Sarah's parents said that I could share her picture. So this is Sarah Brown. She's a friend of mine. She's not related. The Brown we're all cousins, but she's not related, okay? Sarah had this implant. She has a diagnosis where she has epileptic seizures that are not treated through medications. She's had it since she was born. She has multiple diagnoses, and that is just one of the treatments that she's under that is not able to be treated through medication. We were told that although she had received her implant here in Nevada, it was no longer covered by Nevada Medicaid. That during a downturn, when we looked at all of the things that we could offer as a state, that was one of the procedures that was eliminated from our Medicaid approvals. I don't know how true that is. I just know that that's what they were told at that point. So while she was under Medicaid in Nevada, and the implant was done while she was receiving services under Nevada Medicaid, she was no longer able to get treatment on the implant that was in her body. It requires maintenance about every 5 to 7 years, right? So it's like a pacemaker. It has a battery. It has to go in and be maintained, right? So this was her opportunity to get it maintained, but it was no longer covered in Nevada, and there wasn't a doctor or hospital that was able to do it because it was no longer covered by our state plan. As I said, the life expectancy of a generator is about 5 to 7 years. It's replaced during a short outpatient procedure. Sarah was born with disabilities. This was not new for her. She has seizures that are not able to be managed by medication, even though she takes lots and lots of prescriptions. So her family called and said, "Can you help? Can you help?" I don't know. Can I help? So what do? I call Medicaid. I call the Division of Health and Human Services, and they say, of course we want to help. She's a patient of Medicaid, right? And so how do we get that handled? And then I call the hospital, and the hospital administrator answers his phone, and he's at a conference in Florida. But when we called, everyone seemed to answer. We knew this was an issue. and that patients need treatment. How do we get patients treatment? We do that by building the protocols necessary. But because we had taken a downturn and adjusted what was approved on our Medicaid state plan, we weren't able to currently do it. Now, I do want to go on the record as saying our Medicaid division is outstanding, not just because the administrator is in the room, but they jump through hoops to make sure that our patients are cared for. Right? And sometimes it's outside of the approved protocols to be able to do that because we care about patients, we care about Nevadans. But it's important that if you have this in your body, that you are able to get maintenance for it. And so that's where we are and why we're here. So in 2022, the number of implants totaled 26 in Nevada. 19 were traditional Medicaid and 7 were done by a managed care organization. A total of 10 implants were new and 16 were replacements, to give you an idea of the numbers we're talking about. In 2023, total implants were 33, with 16 being traditional Medicaid and 17 managed care organizations. 9 implants were new and 24 were replacements. So we had 24 patients that required replacements or maintenance. A new implant cost $45,606 in 2022, with a generator with a price tag of $34,985. Now the hospitals spend total is about $739,000, with Nevada fee-for-service totaling $257,000. So hospitals lose a significant amount of money in each case, which averages about $25,000 per patient in the loss to the hospital. So without a Medicaid rate, hospitals just aren't able to do this procedure. And that's really what we're asking for, that this committee would consider the policy of adding a vagus nerve stimulation implant back into the Medicaid plan. And then the next step is for this bill to go in front of the Ways and Means Committee so that Medicaid can work to establish the rate, okay? There's one section in this bill. You have the bill in front of you. There's no amendments. It's literally this one section. It requires the director of the Department of Health and Human Services to submit a request to the Center for Medicare and Medicaid Services for a rate for the vagus nerve stimulation therapy device and a rate for a replacement device that must be separate from all other medically necessary costs for the implementation of the device. A rate established must be determined by the methods that are accepted by the Secretary. That's the whole of the bill. I'm happy to stand for questions.
Thank you very much. Do we have any questions from any of the members? All right, we do have one. Assemblymember Hibbets.
Sorry, am I on now? All right. I'm just curious how you came to 82%.
Tracy Brown May for the record. I'm sorry. Could you say that question again?
Yeah, I'm sorry. I was just curious how you came to the number of 82%. Is there a mathematical equation that goes into it? Is it a standard percentage? Maybe Medicaid could answer that portion. I don't know. I was just curious.
Tracy Brown May for the record. I'm going to phone a friend.
Do we need to repeat the question? Okay.
Mr. Chair, Committee Member Stacy Weeks, I think another state had a similar bill. I want to say it was Texas. I see a nod. I was not involved in the drafting of this bill, but this is the approach other states have done. It is a very expensive device and procedure, and so it's just one way to kind of negotiate with that vendor that offers this, because there's not much leverage for the state, but at least it's paying more than it does today. But it is expensive. Thank you.
Thank you. Do we have any other questions? All right. Well, thank you very much. That made my job so much easier. And we will now hear testimony in support of AB 284. Each person has 2 minutes to provide testimony. So many folks here in Carson City would like to begin their testimony. Please remember to state your name for the record, and you may begin whenever you're ready.
Chair and members of the committee, Aurelie Alarcon, spelled Areli-Alarcon, with Carrera, Nevada, on behalf of the Hospital Corporation of America, here in support of AB 284. We would like to thank the Assembly member for bringing this bill forward. Thank you.
Good afternoon, Chair Wynn. My name is Catherine Nielsen. Last name is spelled Nielsen. I am testifying on this measure in a personal capacity. Both my husband and I have had the unfortunate experience of developing epilepsy in the middle of our lives. My husband's condition is significantly more severe than my own, and in 2022, we had to have a quarter of his brain removed due to this severe condition. He was evaluated for a VNS, but the cost of us out of pocket was over $15,000. For general epilepsy populations, the epilepsy-specific cost of healthcare is about $19,000 a year. The cost of care for epilepsy is astronomical. Even with private health insurance, we still found ourselves over $150,000 in medical debt over 5 years, and that included several versions of CareFlight. We had to file for medical bankruptcy in order to survive, and I'm a state employee, so you guys could even look up how much we make. So, and approving any form of medical coverage for those with epilepsy would be life-saving, and I wholeheartedly support this measure. Thank you.
Thank you, Ms. Nielsen, for sharing your story. Well, now, anyone else in Carson City? With that, we're going to Las Vegas. Seeing that big crowd over there, we'll go to AVH for testimony in support of AB 284.
The public line is open and working. There are no callers at this time.
Thank you very much. We'll go now to opposition. Anyone here in Carson City wish to testify in opposition for AB 284? Seeing none, we'll go to Las Vegas. I don't think anybody changes there. Still an empty room. We'll go to the phone line back to you, AVH, for any folks wishing to testify in opposition for AB 284.
The public line is open and working. There are no callers at this time.
All right. Last but not least, let's go to neutral. Anybody in Carson City wish to testify in neutral on AB 284? Seeing none, I don't see anyone running up to the table in Las Vegas. We'll go back to the phone line for one last time for neutral in AB 284.
The public line is open and working, and there are no callers at this time.
Thank you very much, AVH. Would you like to come back? Okay. Well, that's it. Thank you for making my job easy. We'll go ahead and close the hearing for AB 284 and welcome our chair back to the desk. So we'll take a few seconds for her to walk back.
Okay, that leads us to the last order of business on our agenda, which is public comment. So we will now open up time for public comment. As a reminder, anyone here to offer public comment has 2 minutes to provide testimony. Anyone here who would like to offer public comment at this time in Carson City, please come forward. Seeing no movement in Carson City, I see no one in Las Vegas. AVH, is there anyone on the telephone lines who would like to offer public comment at this time?
The public line is open and working, but there are no callers at this time.
Thank you, AVH. Members, that concludes our business for today. We look forward to seeing you on Wednesday. This meeting is adjourned.